Welcome to Champions of Care, brought to you by Oakwood Healthcare. You know, about 3 in every 1,000 children born in America will have cerebral palsy. Today we're going to talk about that condition. Some kids who have it have pretty much normal lives, and other kids can have serious debilitating challenges with that. I'm pleased to welcome in our studio Dr. Derek Bair. Dr. Bair is head of the Oakwood Neonatal Intensive Care Unit, and you're a neonatologist, is that correct?
That's correct.
Tell us about cerebral palsy. What is that? What does that term embrace? And tell us all we need to know to start out with this.
Okay, well, probably the first thing that's important to understand is, what does cerebral palsy mean? Well, unfortunately, when you were to ask anyone, a physician or a parent who has a child with this disorder, is that it means different things to different people. Some people automatically assume these are kids that are confined to wheelchairs and are mentally impaired, which isn't necessarily the case, as you pointed out. One of the other issues is that we also don't know a lot about the disorder. And unfortunately, the term cerebral palsy is, lack of a better term, a junk term. And
junk term? What
junk
does that
term,
mean?
meaning that we don't really, if you were to pick up a neurology textbook, you're not typically going to find a chapter on cerebral palsy. You're going to find chapters on things like acute neuronal injury, or you're going to find things on hypoxic ischemic encephalopathy. And in those, they'll talk about different central nervous system disorders or injuries that will present with the symptoms that we call cerebral palsy.
Are there ways to prevent cerebral palsy in the first place?
That's a very good question, and it leads up to an interesting statistic, and that is that most people assume that when a child has cerebral palsy, something went very wrong at the time of the birth. In actuality, 95% of the time, we do not know why a child has cerebral palsy. And that's not that we aren't that good at trying to figure things out. It's just that we identify a child who comes out breathing, is vigorous at birth, and then several years down the road, the child starts to develop symptoms. Now, as a neonatologist, a good chunk of my population that I work with is premature. And we also know that the premature baby is also different than the term baby. Okay, there are two different animals, if you will, and the type of central nervous injury that they see, whether or not they're exposed to hypoxia, which is where the tissues themselves don't see enough oxygen, or ischemia, where they don't get enough blood flow, how that brain responds to that is different in the preterm versus the term baby. So what we see down the road from a point of injury, whether that be before the baby's birth, after a baby's birth, will affect how the baby presents.
So are you saying, Dr. Bair, that it's much more likely for a child born prematurely to have cerebral palsy than a child who goes full term?
The risks are greater. There are certain risk factors that we know that put a child at risk for hypoxic ischemic encephalopathy. At least that's the world that I live in, where we see injury secondary to either hypoxia or ischemia. The preterm brain is at risk because of certain diseases that the premature infant is inherently at risk for, such as chronic lung disease, the extreme preterm infant. 20 years ago, we weren't talking about 23-week infants surviving because we typically did not have the technology to keep them alive. Now we're seeing more and more of those children surviving, but that population is also at a greater risk of something called bronchopulmonary dysplasia or chronic lung disease, and certainly the latter is easier to pronounce. When we have those conditions, you're in a chronic state to a degree of hypoxia, and we know that that is one of the major risk factors, BPD or chronic lung disease, for developing cerebral palsy in the extreme premature population.
What is this term hypoxia?
Sure.
Again?
Hypoxia is a term where it just means hypo means low and oxy means oxygen, and we're typically talking about blood, oxygen in the blood, or more specifically, oxygenation of the tissues themselves. And the tissue that we're obviously talking about today is the brain.
Now, you've mentioned mobility issues, you've mentioned lung disorders. What else are the manifestations of cerebral palsy and the many conditions that go under that term?
Well, as the name implies, cerebral talks about your upper hemisphere of your brain, and that's typically more involved than the cerebellum. And the cerebral cortex and the core of the brain itself are all involved in how we process information and how we respond to it. And that can also be involved in how we respond from a motor perspective. Motor is, I want to pick up the cup, my brain tells my hand to pick up the cup and set the cup down, okay? How that all gets processed and gets fed back and forth so I don't crush the cup, that's if I were strong enough, or to move it and not slide it across the table, but to sit it straight down, is all involved in how the brain processes information. So those sorts of things can go awry when you have something like cerebral palsy.
Now, could you say more about the connection between mental impairment and cerebral palsy? Because not all children with this disease have a mental impairment, is that correct?
That's correct, Mary. And unfortunately, that's the part that it's very difficult to see. If I were to take an example of a child who comes out at the time of the birth very depressed. When I say depressed, I'm not talking sad, I'm talking the child who's either not breathing or already shows signs of acidosis and malperfusion, and we're having to resuscitate that child. Those kids are the ones that we'd consider at risk. And certainly, one of the things we are looking at is to turn that process around as quickly as we can. Unfortunately, at the time of the birth, frequently we do not know when that event may have happened. Sometimes kids will even resuscitate themselves in the womb, such that when the child's born, we see a baby who's active and vigorous, or maybe just a little bit off on their tone, such as a little bit decreased. But we don't otherwise have any clue as to why that child is the way the child is.
Dr. Bair, this is a fascinating topic, and we're going to talk more in a minute together about the clinical assessment clinic. No, the developmental assessment clinic. Did I say that right?
Yes, you did.
And how this clinic can help parents help their children fully develop. So we're going to talk more about that in a minute, and I'm going to ask our viewers to please stay with us for more on this very compelling topic of cerebral palsy. Stay with us. If you are one of the 57,000 people in Michigan receiving a cancer diagnosis this year, it's good to know that nutrition services are available at no cost to you. The Cancer Center at Oakwood Hospital Medical Center provides patients with free, individualized nutrition counseling on site. You'll meet with a cancer and nutrition specialist to develop a personalized plan to minimize nutritional side effects and weight loss during treatment. For more information, visit oakwood.org or call 1-800-543-WELL.